I wanted to do a little video with you guys on ticks. So I'm Jackie with Skye Therapy Solution, and I practice the Icarus model, but I have had ticks since I was very young, on and off. So transient tick disorder, or what we commonly call tics, which is not Tourette's disorder, it is something that both men and women experience. Sometimes you can get them as kids, sometimes you can develop them as adults. You can develop them with many different labels. They can be within anxiety disorders, they can be with PTSD disorders, they can be ADHD disorders. But the biggest thing is tics are very, very manageable and you don't want to draw attention to them. So the biggest thing to do with tics is you want to make sure, my mini's playing with the camera, that you are not drawing attention to them. You want to make sure that as a parent, you're not saying, oh, sweetie, your tics are acting up. You're saying, hey, let's go ahead and go over here. You're changing the child's line of vision. You're changing their focus. You always want to make sure you're not drawing attention to the tick and you're just re-educating the child to do something else. So how I do that in sessions is whenever a client starts ticking, ticks can be anything from that. They can be excessive blinking. They can be excessive throat clearing. They can be all kinds of stuff. And sometimes we're able to hide them. So you guys can't really notice that we are doing a tick. A lot of times if you're sick and you have congestion, you're going to get a nasal tick. If you have pain in your neck, you're going to get a neck twitch. They kind of go and they're a little bit transient, so they can move around your body. Sometimes they can be as big as doing that. This is a tick I did when I was little riding my bike. Um, so with the ticks, as soon as you can redirect the child's brain and their eyes to do something else or turn something else, what happens is over time, their body automatically does that and they get themselves out of the tics. And then if they can successfully do that for 90 days, their brain habituates to it. So they automatically do that instead of having tics, and that will significantly reduce the tics. I've been using this model probably for 10 years in practice, and it's been really effective with my kids with transient tic disorder or my kids that just develop kind of nervous tics or anxious tics or ADHD tics. So that's what I recommend for parents. And I'm not sure what else is out there on tics, but I really like to teach you guys the models and the techniques that have worked for